So the equipment that we are looking at getting or hoping to get roughly just monitors the vitals specifically on those patients that we have to anesthetize for procedures, which, as you can imagine, here at a zoo we do a lot of procedures that we do have to use gas anesthetic and inhalant to facilitate those immobilizations. So this piece of equipment monitors a number of vitals for us. So heart rate, respiratory rate, gives us an actual EKG, assesses some of the breathing of the gas. So not only the anesthetic gas, but the CO2, the oxygen. One of the important things for us to be able to do is to assess how much gas anesthesia is going in and going out. So this specific unit would give us that information a little bit more detailed than what our current system is. So a lot of our equipment is older, and so by upgrading our equipment, it's not only better equipment, lasts longer, but it also has some better functions of monitoring gas anesthesia. So anytime we choose to immobilize an individual comes with risks. And so one of those risks involves the drugs that we're administering to them to allow staff to be able to safely examine them. And the way we combat those risks is by utilizing this piece of equipment to monitor vitals. So sometimes those drugs can alter heart rate or respiratory rate or blood pressure. And so by evaluating those under anesthesia in those exams, when we start seeing some of these abnormalities, we can adjust what we're doing for their safety as well as ours as staff. So this specific equipment and controlling or monitoring our anesthetic levels is super important on those species that have big dive reflexes. So specifically pinnipeds, seals, and sea lions. So anytime we have to anesthetize them, there's an inherent risk, just given the way they function physiologically, that by holding their breath for a long period of time can really skew some of the way we perceive anesthetic depth. And so by, again, monitoring what values are coming in and out of them during anesthesia can give us a better idea of their level of depth and how we need to anesthetically assess them. So we try to capitalize anytime we have an animal in here for an evaluation. And the way we capitalize is being minute and particular about whether that's hair coat assessment, skin assessment, if there's something that we're trying to fix, really being able to see in depth at what that is. And that's really nice with surgical lights, with lighting that is specifically made to evaluate really close up, really hands-on. And it makes it hard when that isn't available, or it makes it not as thorough as we would like. We maybe only get hands on these animals once a year or once every other year. And so when we do have them, we really try to capitalize and make sure that we have everything in order here to be able to evaluate that patient as best as possible. And so whether that's surgical lighting or the right tools or the right anesthetic equipment, they all kind of play the same role in our goal to be able to better assess that patient when we have the opportunity to. The community does play a really important role, especially supporting Blank Park Zoo in not only conservation or a recreation throughout the community of Blank Park Zoo, but also directly in the health of these animals. And so by supporting us just a little bit with the goal of trying to get some new equipment, a lot of support, whether it's big or little, in a big capacity, can really make or break the difference of some of the care here at Blank Park Zoo, specifically with some of these animals that are maybe on the fringe of safety-wise of being able to handle them, and that those that do require more sophisticated anesthetic procedures, this equipment is pivotal in making sure they get the best care possible.